Good afternoon, and thank you for joining us today for our latest episode in our webinar series. Today, we'll be talking about creating a listening culture to improve employee recruitment and retention. And we're joined by two great speakers, Dawn Smedley, Head of Culture at WorkBuzz, and Amanda Scott, who's CEO at Forest Healthcare. Before I hand over to Dawn, just a little bit of housekeeping. If you do have any issues with the platform, or you feel there's a lag or there's something going, just shut the platform down and join again through the link on the email. We also want to make this as interactive as possible. So the agenda for today will be Dawn speaking to Amanda, followed by a Q&A. So do make sure you put any questions to them throughout the presentation, and they'll get to the questions at the end. So feel free just to use the Q&A button on the screen. So it gives me great pleasure to hand over to Dawn, who will take you through today's presentation. Welcome, Dawn.
Thank you very much, David. Super excited to be here, and even more excited to be joined by Amanda, who is the CEO at Forest Healthcare. And if it's anything like the first conversation I had with Amanda, then it could go in a multitude of directions. I think one of the greatest joys of my job actually is being able to connect with people who are equally as passionate about culture, about employee experience. And I think I felt that connection from the moment that I met you. Is that not true, Amanda?
Oh, that's very kind, Dawn. Thank you. We should maybe end it there on a good note with all that praise. But yeah, no, thank you for that. That's lovely. And I do feel passionate, more so than ever, about creating a healthy and happy culture at work. So yes, I think, we riffed rather than spoke, didn't we?
Yes, it was an absolute joy. And I think when it's UK Care Week, and I think there are huge challenges across the sector, and hence why today we're specifically talking about employee listening in the context of recruitment and retention. But I'm a great fan of stories, and I think for anyone on the call, it will be really inspiring to hear about your journey to become the CEO at Forest Healthcare, because I loved hearing it. So let's share it with the listeners.
Okay. Yeah, certainly. So heading back into the realms of time, I was at sixth form, really fairly undecided and ambiguous about what might happen next. And a job as a care assistant popped up in a care home. Perfect, and some pocket money, and off I went. But I guess I was blessed, Dawn, because what happened straight away was I kind of felt at home. It felt right, and I really enjoyed it. And there was an immediate connection with the people that lived there, and also the people that worked there. But what was also really exceptional looking back about that was it helped firstly solidify the thoughts that I was having about training to be a nurse. But when I expressed that at work, the nurses who worked there wrapped themselves around me almost immediately. So that culture of, okay, let us show you everything that we can, let you show what nursing means. Even to the point when I was accepted for nursing and leaving at the end of that summer, they were telling me what I'd need in my flat while I trained, and buying me mugs, because they were saying you'll all congregate and have coffee at the end of a shift, and you'll need mugs so that they all come to your room. So we bought them for you. And I take away from that sort of reminiscence of what a lovely culture, nurturing, encouraging culture to take me through. So I went off to the NHS. I did my nurse training. I was really excited by all the drama. So I worked in paediatrics and intensive care for a while. And then again, a job popped up. I wanted to move away from the NHS, and a job popped up looking for a deputy manager, a brand new role that had been created in a 120 bedded home, relatively local to me. And I think I told you, Dawn, that my husband had to come home and look after the little ones while I went for the interview. And as I headed out to the car, I laddered my tights. So there was a moment when I was kind of thinking, if I just drove around for an hour, he'd never know. I could just have a break and then go home and say, oh, I didn't get the job anyway. Something propelled me there. And it was an immediate switching on of a light. So they took me on a tour of the home, and everything that I perceived would be a care home, this home wasn't. They'd invested hugely in the ambience and the style and decor, and there was just such a lovely feel as I took that tour that in my head changed from I'm coming along for this interview to I want this job, I really want this job, I wish I'd prepared more. So I got the job, and that really was the beginning of me finding my specialism and my tribe. So I had the opportunity to move 18 months later and take my first home manager's role. Then some changes happened in that organisation, and a couple of people moved on. The director of nursing invited me from another company to go and join her as a quality manager. I moved into quality directorship, and then eventually through operations into managing director and onwards to CEO for the last 3 years of Forest Healthcare. So last 26 years explained in a whistle stop.
Well, and it's amazing. And thinking about people who have actually registered to attend today, I think we've probably got people across all of those roles. So right. I think your journey is actually going to be quite inspiring for people to realise that actually, you know, what it's the art of the possible, isn't it? Absolutely. If you're passionate about what you do, if you love what you do, and that's what we see across all of our health and social care clients, is that connection to making a difference, to wanting to kind of change the lives of people. Wow. Then hopefully people hearing your stories, almost that kind of inspiration behind that as well. But I love your laddering tight story. I think we described it as a sliding doors moment, didn't we? Exactly. Yes. I remember it like it was yesterday, and I really hope people do feel inspired, Dawn. I meet a lot of talent along the way, and sometimes that's just people that need that voice that says, but you can. Dare yourself. If you're in your comfort zone, you're taking up space, kind of push yourself, do that next thing that scares you a little bit, because you'll be amazed at what comes from it. And that kind of brings us nicely into, what we're talking about today, really, and that's the cultures that we create. And often I talk about the fact that, we often talk about employee engagement, but really what engagement is a choice. And we choose to engage with the vision, the mission, values of an organisation, but we can equally choose not to. So all we have within our circle of control is create a culture that people choose to engage with. And it feels to matter now more than it ever has. Why do you think that is?
Well, I heard a quote fairly recently, which I'm probably going to butcher now, but I'll try it anyway. But somebody was talking about engagement, and they said, really, engagement is the end product. It's an outcome. And yet we say, engagement's really important, and we should make sure we engage with this team. But the engagement is the outcome of listening, responding, and I think making people feel valued and safe. And the outcome, therefore, is people feeling engaged. Why is that really important more than ever? I mean, it's no secret there is a skills shortage. And so, it's paramount to me that we hold on to those experts that we have in our teams, people that know the residents, know the home, know how things work well. So we have a vested interest in retaining those people. But aside of that, I think in terms of engagement, we have a responsibility as well. So it isn't an aside thing that's kind of slotted into a strategy at the end of what else should we do, but almost the groundwork, as far as I'm concerned. Why would you build a team that you're then going to not treat so well that actually you spend 90% of your time just replacing that team.
Yeah.
And juxtapose that with build a team, drive and build that expertise, knowledge and collaborative working, and the opportunities are endless.
And I think, thinking about that one step further, it's how do we know what really matters to people if we don't ask? And to your point, it is about listening, it's about responding, and it's about the intent behind in which we listen, to build trust, isn't it? Ultimately, the reason why we often stay where we are is because we trust the people around us, we trust the organizations we work with and for, and we trust that they're going to do what they say they're going to do.
Exactly.
So when we started talking, I really vividly remember you saying kind of, it feels like I've got a sense of how people are feeling, but what I don't know. And that was where our conversation started around the importance of employee listening and, looking to run a survey to kind of ask everyone across Forest Healthcare how they were feeling.
Yeah.
Why is that? Why was that so important to you?
So I remember the conversations really well, Dawn, and through COVID, what I kind of been forced to do was, so I joined in September 2019. I had a big plan. I'm going to do all these things. And I was looking back at the board minutes the other day at, that first conversation around, there's something coming towards us that could be quite tricky. So some of those things were derailed, but in and amongst that time, the outcome of engagement was paramount. But I was trying to look at what we had in our toolkit already and what we needed to put in place or do more of or enhance. And so that's what I did. I started, thinking, well, we absolutely must have an employee assistance program. And, we need to keep people's morale up. So let's run some competitions and, give people a space at work during these difficult times to think about something exciting and fun rather than just, the worry that was COVID. But I knew that I was grasping at straws and I was doing to our teams and our organisations rather than responding to our teams and organisations. And that really bothered me. But I also knew that the timing was way off chart to start saying, I know that you're working back-to-back shifts and haven't had a day off, but could you fill out? So I used it, intuition and informal feedback to begin with, and then really desperately wanted WorkBuzz to help us to do two things: help us consolidate what I thought. To your point, I thought I knew, but also really give people a formalised voice and an opportunity, but in a proactive way, rather than them feeling, this is a checklist. So much more. I wanted them to feel like, we've now got a chance to really tell Amanda and the team what works, what we could have differently, and so on. So, we kind of managed to pull that together and get the results in. The results were counted and verified. Yeah.
And how important do you think that has been in terms of you having a better understanding of from a recruitment and a retention perspective?
Yeah, so the things that we hoped we'd got in place when they were confirmed, that was a huge relief, because rather than us heading in a direction and then having to do a complete U-turn and begin to unravel things, there were a good number of landmarks of confirmation that we could say that's good, that's been well received. So that really helped. I think it helped just to give the teams a voice as well. And to give an opportunity. And I wanted it to land in a way that was really reassuring. So I think I discussed this with you, but I certainly discussed it with our home managers and our operational teams and cascaded that message. I don't mind what the results are, just be honest. I'd much rather have an honest survey that gives me, a great starting point than something that you think people want to hear. So I get a sense, because we got great uptake of the survey, that we have a really honest reflection of where our organisation is now, and that's helped massively feel committed to the people plan of what we do next with it. So what do we do with all this information we've now got?
And I think that's why I loved every single conversation I ever had with you, because often it's the intent behind what we do that makes the difference, and how we build trust and how we get people to respond. Because if people don't believe that action's going to be taken, if people don't trust that they can be honest and there'll be no repercussions, then there's no point in doing it. It's just a tick box exercise, isn't it? So I think that's what I felt from you and all your team from the start, was that there was a genuine desire to know how people were feeling. And we'll move on to it in a bit, but I think a lot of the language that we talk about at WorkBuzz now is understanding the moments that matter. And I think when we do that, and we do that well, then, you know, we might not have all the answers, but actually we've listened, and we can enter into those conversations afterwards to decide what to do with the right intent and have really meaningful conversations on the back of it. So it was a joy. And I think, just to pick up on another thing that you said, I think people have wanted to have more of a voice, especially on the back of the pandemic. I don't think we've ever seen kind of a better response to the surveys that we've been running at WorkBuzz, because people have, the world of work has changed, people's expectations have changed, and I think expectations have increased as well, and people want to have their say and to be able to make a difference as well.
Yeah, I couldn't agree more. And I think, you know, there's never been a better time to make sure we listen to what comes through. If we ran a survey again, you know, on an annual basis, and the feedback was, what's the point? I told you this last time. I think that would be a real shame on us moment. So, you know, it is giving that people that investment in doing something with the information that you gather. It's
having the courage to face into the feedback, even if it's not positive, which is hard to do sometimes, isn't it? Because sometimes it's laying ourselves open and saying we're not perfect. But actually there's something in saying that as well, because that vulnerability builds trust as well, doesn't it? Because you're not always going to have all the answers, but you can try your best, can't you? And at every level.
I totally agree, and I think there's something about authenticity, isn't there? You know, I remember in my junior years, you know, making a mistake or not understanding something, whatever the scenario was, but a ward sister, a matron, a consultant, taking that time to reassure you with, I used to think that, or I didn't understand that till recently. Such a simple thing, but you know, the authenticity and humility of that person to be forgiving, I suppose, for want of a better word, or understanding, maybe is the right thing, encourages that inquiring mind and encourages that person to feel safe and remain valued, even though they don't get everything right all the time, because who can?
I love the word authenticity. And have you ever, just on a side note, have you ever watched the Brené Brown clip on vulnerability? For anyone listening, if you want to kind of better understand the impacts of vulnerability, all of the Brené Brown stuff is super powerful as well. But I think there's some real lessons that we can bring into the workplace around how to have those courageous conversations, how to be bold, you know, how to face into some of those difficult things that happen to us on a day-to-day basis at work. But when we do it in a vulnerable way, then it builds connection. And I think there's so much research out there at the moment to say that there is such a lack of connection in the workplace, and everyone's battling with how to create more of it, more opportunities to connect. Then, but I think, you know, bringing the human into the workplace is kind of what's needed more than anything.
Definitely. And, you know, in the sector that has been my adult life, really, you know, we are people looking after people. So that human connection is a requirement. And if we're expecting people to afford that empathy and kindness and respect and listening approach to the residents that they look after, then, you know, don't they have a given right to be afforded the same themselves? It'd be such a embarrassing contradiction to say you must be all of these great values to the residents that you care for, but don't expect any of that from us. you won't get any of that from us at all. That would be terrible.
I think that really inspired me when you talked about, some of the mystery shopping that you do. Well, is that the right word? Mystery shopping across the care homes within Forest Healthcare as well. And, how you help people understand kind of the expectations from a, how we treat people perspective. Do you want to just talk about that a little bit?
Yeah, I mean, this is my soapbox, Dawn, when I talk to people. I will admit I do have a life and do get busy at the weekends doing other things, but every now and again I will phone a home and just see who picks up and how that call goes. And one of the most frustrating things is when you get, well, the manager's not here at the weekend, can you call back on a Monday? And what I explain to people is, you've got to try and imagine the journey that took somebody to that phone call. So you imagine that dad's been struggling really for 2 years since mum wasn't around anymore. And then, he had a catastrophic health event a year ago, but was desperate to stay at home. And, the challenge to the family to help support him being at home has been exhausted, and it's just not working anymore. And the family have had to have their discussions, and it's been painful and sad, and there've been tears and maybe even disagreements. And then somebody's given the job to make that call. Sorry, the manager's not here, call back Monday. How is that? I know. So it's trying to get people to see the bigger picture, and not in a critical way, but just explaining to them how important they are and what an important call that is, and how they can change someone's life if they handle that call well.
Yeah, it's the power of the storytelling, isn't it? And it's making it really real for people to understand.
Exactly. But it's easy to make assumptions, isn't it? And this is something that I think is a danger when you've worked in a sector a long time. Your assumption of level of understanding is easy to transpose onto a team or a workforce. So you never want to patronise people. But at the same time, you can go the other way, which is to just say, well, everybody knows that, right? So, if you didn't do that properly, that's you failing to do, which is something that's obvious, rather than saying, actually, has anyone ever explained that to you? Has anybody ever talked to you about that journey and explained the impact of doing it well or not doing it so well? So I do check myself, and I ask my team to check themselves. When we're trying to bring something about or educate in a particular way or motivate in a certain way, to remember that everybody's starting point isn't the same. And I do think that is really important, because if you think about a large group of people that work for you or work in a particular environment, and you're in a leadership role, there's no chance that every single person is going to be at that same starting point. So I think that's where it leads you to. Of course, there are some unilateral pieces of educational learning that need to be put into place, but that person-centered bit, where you see the individual and their own journey.
Yeah. And it reminds me of an analogy that we're using at WorkBuzz that everyone laughs at me for at the moment, and it's about buckets.
Right.
And so you knew there was going to be a random interruption to this webinar somewhere, but I read a book, I don't know if you read it to your kids when they were little, called How Full Is Your Bucket?
No. Go on.
Brilliant. So you imagine, Amanda, that you start every day with a bucket on your head.
Right. Okay.
And your bucket is full.
Right.
But there are things that happen to you throughout the day that can empty that bucket. So little interactions that you have. So you take, a child at school, for example, you're late for school, you lose your school socks, you get into school, you get told off. All of those things can empty your bucket.
Right.
But actually, a teacher being kind, a friend giving you a sweet, whatever it might be, can fill that bucket up. And I think it's a really powerful analogy when we think about the employee experience, because, or kind of the experience that you're creating in your homes as well, because we can fill every person's bucket. We can choose to do it that way by the words that we choose, through the interactions that we have. And we can intentionally design moments that are there to fill people's buckets rather than empty them. So I think it's, although random, I think it's quite a good way of bringing to life kind of the experiences that we have at work and in life in general.
I agree. I agree. I'm not going to order the book on Amazon, but I'm going to steal the story, I think, because I really like it. And it makes perfect sense, doesn't it? And those opportunities can be found in sometimes the simplest of places. So
Absolutely.
There's an example. We have carehome.co.uk, which is kind of like a TripAdvisor for social care, and we have relatives that put up 5-star reviews and tell us when it's gone really well, and sometimes they're fortunately, not often, but sometimes they're not 5-star, and they tell us another story. So what we could do with that is take that review and watch our score in carehome.co.uk go up, and let the group know each year when homes are nominated as top 20 care home group for their scores in carehome.co.uk. We could send out a note and say thank you. But what we do instead is every single time one of those reviews comes through, we send it back to the home, and it's a group email, and everyone piles on to say, well done, amazing, you're a brilliant team. But not only that, we pick out the words that reflect our core living values. So if somebody's talked about how the person or the team went above and beyond, we say to them, and we're even more excited that they've mentioned above and beyond, and that's one of our living values. So one of our core values. So what assures me and excites me is it's a living value.
Yeah.
We say we do, and you've just proved we do. So we all pile up. Like that costs nothing, and we get great feedback that it's been taken into the flash meeting in the morning, and everybody's given a cheer and a whoop, and but of course it motivates people to do it again. So
that's properly embedding values, isn't it? When people talk about it and saying it's not just a poster on the wall, it's in these moments that we show that they are living and breathing things across the organisation. But I think that's often the miss, isn't it? It's connecting the dots, and you've got this thing happening over here, but how do you smartly link it back to actually what you're creating from a cultural perspective, which is those values that underpin everything that you do.
Exactly. And what a shame, if you're talking about your vision, your mission, and your core values, and you ask a carer, do you know what our core values are? And they say, oh, we did this. Then I'm like, we've got some work to do. But if they may not have the words right, but they can say, well, this is how we have to behave, and this is how we want to behave, and then that it isn't a strap line on a website.
Yeah, so smart there. But like you said, it's just the simple things, isn't it? It's like the fill in the bucket analogy, but brought to life, because we can have our strategy, we can have it all written out, we can have these things that we say we're going to do, but the only way to truly live and breathe them is to share the stories, involve people in it, share success, celebration, get people to feel as if they're part of something together. And it's that feeling that then becomes infectious, that then makes it happen again. And all of a sudden, when we talk about culture, that's what it truly is. It's a collection of experiences that are happening across Forest Healthcare, isn't it? And we talked a little bit, just as we also discovered through our getting to know each other, is that we're both really passionate about recognition and appreciation as well. And I think we talked about the power of career anniversaries as those pivotal moments, didn't we? Do you want to talk a little bit about how you celebrate those?
Well, we've just introduced our celebrations for recognising long service, and again, I drew this from another group that I acquired working for a different company a while back, and I walked around these homes and asked people. I always ask people, how long have you worked here? And I was just blown away by the length of service, and it's relatively unusual in social care. There is a degree of turnover that means that 10, 15 years isn't that common. So the same happened to me when I came to Forest. I was just amazed. And one of the things that we did recently, before we sort of formalised the recognition for people, we went around a room and asked people how long they'd worked. And there were the 10, 15, 20 years. And we added all those numbers together and then said, so there's 250 years of experience.
Wow.
In this room.
Crazy.
From what we know, and imagine if we all knew what we all knew, how powerful that is. But as well as that, we wanted to introduce, formal recognition. So we've got some lovely awards, and we've got some vouchers that we send out with those awards. So we started with 15-year awards and 10-year awards, and we're backing in to 5-year awards and first anniversary awards as well. And what we also did this year was introduced birthday off. So, that's for everybody then, that there's just that nod to, whose birthday isn't special, and there will be the occasional person that says, well, actually, for my reasons, I don't celebrate birthday. Well, let's pick a day that's important to you then and make sure that you have that day. And that's been so well received, because I think it points to recognizing something that's really personal and saying, it's bound to be important to you, therefore it's important to us. So we mark it on the rota, and it's like the gift that keeps giving, because then people look at the rota and go, oh, it's 3 people's birthday this so
it's reasons to celebrate, it's reasons to connect, and it's reasons to get together, isn't it? Like, why do we need a reason? But absolutely, I love that. But I think the thing with career anniversaries as well, I think especially, we're talking today a little bit around recruitment and retention. It is hard to keep people in social care, isn't it? And keep them for a long time. I know when we talked and prepared for this, you told me about your tea run story and kind of the pressures almost on kind of the things that you don't even think about when you don't work in care, like me. So stopping at the end of that first year and going, yay, you're still here. We're so excited about what you've achieved so far, but imagine what you can do in the years to come, and almost share that story of the difference that they've made in that first year. And it's a really powerful turnaround, isn't it?
Definitely. I think there's something here as well. We haven't done this yet, but I'd love to present every new starter with a journal and ask them to journal, and then at the end of the year share if they're willing to, an entry from month 1, month 2, month 3. It was the best advice I was given as a home manager, because a very, very experienced home manager said to me, once you've got over the fact that you've got the job and you're so excited, in a very short amount of time you'll feel like you're not making a difference, because there will be so much to do. So write down whenever you can what you've achieved, daily, definitely weekly, and keep that diary in your desk and look back. And it was the best advice I could have had, because that novice to expert leap is such a hard mountain to climb. And and it's so easy to either convince yourself or somebody else convince you that you aren't getting up that mountain. And that check back of, look, when I started, I was terrified of making a cup of tea for the residents. And I think that's what you were talking about earlier, Dawn. I was telling you, as a carer, I was given this task, like, well, you're brand new, you're not much use to us, but give all the residents a cup of tea. And I was like, horrified. People are diabetic. What if I give them sugar? What if somebody gets scolded? What if somebody can't manage the cup? So what seemed like such a simple task was terrifying to me. So I firstly try and hold on to that memory of how terrifying it is at first. But also, if I could have looked back at my own journal to say, day 1, week 1, terrified of making tea for residents.
Yeah.
Day 365,
Yeah, look where you are now.
Day 365, week 52, running the shift, taking hold of the shift. You would encourage people to see their leaps, their personal leaps, rather than just a certificate or a bit of paper or a long length of service.
Oh, you should absolutely do that. I think that would be so powerful. And then to ask them to share some of their stories and as reflections for new people coming through, hearing those reflections at the end of the first year. And then the people that have been there longer saying, thinking, I remember that. I remember feeling that way too.
Yes.
So again, it's joining people together in a way that is really human, isn't it? It's not about, hey, look at me, I'm amazing. No. It's like, there are little things that we go through and little wins that we have to celebrate before we get to the big milestones as well.
Well, I don't think there's anybody that would be talking or listening that wouldn't recognise that moment when you start that first job. You're not entirely sure where the office / workplace is. You may have been somewhere else for the interview. You don't know where to put your bag. You don't know where to put your coat. You don't know whether lunch is provided or whether you need to bring your own. You don't know where the bathroom is. And that's your starting point on day 1. Remember how you feel when that happens, and then empathise with other people on day 1, day 2 and forward. It just, again, humanises it.
Yeah. So I'm conscious that we've probably got about 5 minutes of chatting left, and then it'd be really nice to see if there are any questions, and then we can get you to answer those as well. But thinking back to, we're talking about employee listening, recruitment and retention, culture. If you were to give one piece of advice to those working in healthcare right now, what would it be?
Wow. One piece of advice, you say, Dawn. What I would say is, I would say, don't frame a strategy for engagement, listening, culture, all of those buzzwords that we've got at the moment, and then march forward without being versatile, listening to feedback every step along the way and being able to adapt to what you hear back from people. That's what I'd say. Don't lay a plan down in front of you and say, well, that's what we're doing for the next 12 months and we march on, because you may be really disappointed to find that you get to the end of that and you should have taken a sharp left a quarter of the way through, because what you perceived as needed wasn't working or didn't touch the mark. So I think we have to be listening, and we have to be looking out for that constant feedback, formally and informally, all the way through, to make sure that you're getting the best out of the energy that you're applying to it.
And I think that's what we've seen as well, just to add to that, is just that need for more regular listening as well. Because like you said, if you don't know what you don't know, how do you change? How do you check in to see if things are working? And how do you pivot if you need to, if you're just going on regardless?
Exactly.
So I think that shift to more regular listening has come through kind of thick and fast in some of the latest research that we've done on the state of employee engagement across the UK as well.
Right.
But let's see if anyone has got any questions. I'm conscious that we've been having a nice little chat over here for the last 40 minutes. Has anyone got any questions? And if you do, did you want to put them in the Q&A now while we have Amanda, which is a great privilege? And while you're doing that, you actually received the top medium-sized company in care award, I believe. Do you want to tell us a little bit more about that while we see if any questions come in?
We did, Dawn. So as I referenced that earlier, this was really exciting for us, because this isn't, this isn't the Oscars where it's Hollywood celebrating Hollywood. These are the people who are either the residents or the nearest and dearest and loved one of the residents. telling us what they think and giving us their feedback. So it's powerful to us to receive those reviews in the first place, and they mean so much to us. But it was so exciting to be awarded top 20 medium-sized care group across the UK. So that's out of, I think it's about 18,000 care homes. So, and that was the third year. I have to get in there. It was a hat trick. That was the third year in a row that we've managed to receive that award. So, you know, we've upped the bar now, and we've said, well, we want to go for those that only medium-sized care group with a 9.9 across the whole board. And it's not just about the number; it's about the feedback that we get. So, yeah. We were thrilled, lots of cheering and jumping up and about and excited. But what was so special about that was we could say everybody won this award. This wasn't Forest won it. This wasn't head office won it. This wasn't the C-suite or the ops team. Every single person that held a door open, that smiled, that passed a cup of tea, everyone won that award. That was really special.
I bet that was a celebration.
Yeah, and more to come. Yeah.
Right, we've got a question from Rachel. Could Amanda provide an insight into induction onboarding at Forest? Do you assign buddies or mentors? Those first few weeks are so important for retention.
Yeah, no, really good question. Yes, we do. Again, what we're looking further into is developing expert buddies, so people that have received really good feedback from the people that they're buddying. So again, this isn't a tell on you scenario, but what we want to know is people that love orientating and inducting new starters, and then being able to assign those as kind of our formalized buddy. If you like, so that we make sure that we've got a standard and an expectation that we can promise to people on their journey coming into us, and know that we have a really good chance of keeping that promise. Because we use that expression a lot, keeping our promises to our residents, keeping our promises to our families, but also keeping our promises to people who we've interviewed. At that point, they're our customer, and they're judging and assessing us. And there's nothing worse to be told than where you said I'd get a buddy, and she showed me where the locker room was and I had to get a sandwich, and I never saw her again. This isn't what we want. So in short, yes, we do, but I think there's so much more that we can do to develop that further.
Okay. Hopefully that answers your question, Rachel. What was the most valuable feedback that came out of your survey?
Another great question. And it was kind of obvious. And at first it hurt a little bit. And then I was like, no, I get it. So what the survey told us was that while the homes were very connected to the leadership team and very connected to themselves as an entity, as a home and a team of people, they didn't feel connected to each other's homes geographically or belonging to that group of homes. And that initially was like, well, how can that be? Because we call ourselves a family of homes. And then I realised that actually some of the communication processes that we had in place reached our managers with the opportunity to filter, but that we didn't reach out to the wider team to share connection. So that's something that we've really started investing in now. So we have peer forums. So our deputy managers have all come together and they're all getting to know each other, but they're also moving through an accredited training program at the same time together. We've done the same with the wellbeing team and activities team. So they're supporting each other and have got to know each other. So it was a stark moment of like, oh, and then but there's so much we can do. So this is great. Amazing. Problem that you can fix is great, isn't it?
Yeah, it's the ones that are harder to kind of pinpoint that are harder. Yeah. Thank you very much. Right, Neve has asked, how do you handle the increasing living cost related to increased wages and retention?
Yeah, now that's a problem that's more challenging. Was that Neve? Yeah,
It was, yeah.
Hi Neve. That is a more challenging difficulty, and you know, I won't bore everybody with the kind of the higher level lobbying and you know, discussions that we have in terms of funding and things like that, but they are all underway. So fair cost of care exercises are happening with all of our local authorities, and essentially you know, we have to make sure that our business is sustainable, and that means that you can't just race into or fall into a race with competitors of saying, well, they do this, so we're now going to do this. It's a race to the bottom, because there is always going to be a ceiling where that has to stop.
Yeah.
But what we are working on, we do a lot of work with the Care Workers charity. I've just done a Tough Mudder to raise some funds for them.
I was going to mention that, actually.
The bruises have almost healed, Dawn, almost healed. But we've thrown our heart and souls into making sure that we support that funding, because that charity does a great deal of work with care workers. We've looked at an engagement and focus package with all of our teams. So, you know, discounts, connection to GP services that are free of charge, and so on, just to give something that's a little back, and work closely with any salary challenges that come through. So if we have a team that say, look, you know, we do have competitors around us that are lowering us constantly, then, you know, I personally go to that home and meet with the team to discuss what's happening and, you know, how's that playing out for you. But it's being realistic. I don't make promises I can't keep, and I can't make the promise that I'll match any price. Neither can John Lewis anymore, by the way. I saw it on a poster this weekend. So, you know, the world is changing in front of us. But what I can also do is try and offer people all the other things that matter to them, and to engage with them and work with the lobbying. So I belong to a number of memberships and groups that, you know, keep our voice loud at senior level to say we can do better.
Amazing. Thank you. And then Charlie asks, do you have any advice for employee retention in the domiciliary sector? I hope I said that right, where in team meetings are a lot more difficult to accomplish and therefore to achieve regular feedback?
Ooh. Well, this would be a supposing answer, because I don't touch domiciliary care, but I can completely immediately see the problem. I mean, I would say, don't be too cross if it's been tried and hasn't worked, but I would say one of the things that was forced on so many people through necessity through COVID was the opportunity of digital connection. What are we all doing here today, for example? So I do think there's opportunity to connect that way. And I do think, you know, there is opportunity to take it outside of work as well. You know, informal meetups, informal team building exercises, you know, the get to know and the buddying are all opportunities. But I completely understand the difficulty that it's such by the nature of its work, you know, it has that degree of remoteness to it. But I you know, if you're hoping to for that to be better way you work, I would say then, you know, there's some starters for 10 with ideas, but the question should drive that thinking. That thinking and listening. Yeah.
And I guess asking kind of what would work for them as well is the great starting point, isn't it?
Definitely.
Thanks, Charlie. I hope that helps a little bit. What are the common values that you see in the companies that best retain their talent? Woo.
So best return their talent. What do you mean by that question?
What are the common values that you see in the companies that best retain their talent?
Okay.
Are we talking about, yeah. So I think we're talking about well, what are your values at Forest Healthcare? Tell us what your values are.
Yeah. So to go above and beyond and to see that as opportunity to support and to offer empathy empathy and kindness are all these core values that we work to there. In terms of retaining talent, so I think the question is values that we talk about, that are values for our residents, but also values to each other. And what best retains our talent, I would say, is kind and experienced leadership. So where we see long service of home managers, their team, the phrase I hear so often in happy, well-retained teams is, it feels like a family here. And I feel like I can go to, fill in the name of the manager, I feel like I can go to them with anything. So that sense of really understanding each other and really trusting each other for the good days and the bad days, and feeling safe at work, are really important to people. And length of service, therefore, with our home managers, with all their experience, is really important. And if you get that right, you start to see the team expand behind the manager in terms of length of service. So what we typically see is where a home manager has longevity of service, they have a core team behind them that have all also got length of service. And one of our home managers has been in the same home for 35 years.
Wow.
I know. And she talks about people joining from sixth form that are now got grandchildren, and that is just such an incredible story. So I would say a feeling of belonging to something that is more than a job, and
we see that come through in the research around that connection to purpose. But I think when we've spoken before, you've talked about exceptional kindness, haven't you? And you've talked about the creation of a safe culture where people feel safe, but feel like they've got a voice, that they can be heard. So I think, retention is just coming through in all of these questions. Matt asks, what do you feel is the number one reason for staff churn, and how can this be reduced?
So I think that macro, there's been some big drivers on staff churn for social care. Brexit, of course, there's a big bump in problems there with vacancies. COVID then resulted in what the sector talks about as burnout, but I heard a professor speaking last week, and she referred to it as moral distress. And I thought that was probably far better description of what people are feeling, like upset and distressed and sad about what they've worked through, as opposed to burnt out. So that hasn't helped as well. But then, of course, the mandatory vaccinations for social care were a really damaging to the sector, where people really objected to being isolated and pointed out as, in the end, the only population of people that must, or you can't do your job anymore. And that did not feel good to people. We did not take a no jab, no job policy. We had to, as it was made regulation before it was revoked. But I adopted an engage, enable, and educate approach. So let's educate people why the vaccine is important. Let's enable them to go and get that. So if that's in work time, that's fine. And let's engage with people and say thank you, and really cheer and celebrate that they've seen the importance of it and been and done that. But it not only hurt people, where in some parts of the sector they felt told, like, no jab, no job. What a terrible tagline. I understand why people were heading in that direction, but ouch. But I think it also had an impact on people that were thinking about coming into social care. So what am I going to be told I have to do with my body next? So, we've got a lot of work to do to unpick those three macro elements. So they're the big picture things. I think, you know, we all know the soundbite. You can get more at Aldi, working, you know, the press are running it all the time. So that's our challenge, particularly when there's a cost of living crisis coming along. And that's where I hope I can inspire people to see not just the hourly rate. And I'm, you know, I'm not neglecting to understand the pressure people are under, but not just see the hourly rate, also see the reward in the job that they will be doing. But I hope I can inspire people to see the jobs that they can go on to do and the career pathway that lies wide open in front of them. And we have an open door welcoming people in to take that pathway and journey with us. So, you know, I hope that we give that message strongly enough to continue to hold people that we value, of course, but draw people towards us as well. Long-winded answer to that, sorry.
I think just to add to that, our research backs up everything that you say, because I think across all of our employee surveys in health and social care, then when we look at the reasons why employees state that they're thinking about leaving, then it's around feeling valued and appreciated. It's around career progression and opportunity, and it's around pay. Yeah. So, you know, the things that you've mentioned there and the things that we've talked about throughout the webinar have touched on all of those things. Good. It's around almost painting that picture of a future career across social health and social care. It's around making sure that people genuinely feel valued and appreciated for their contributions through a lot of the things that you're doing at Forest Healthcare, but hopefully some ideas for those on the call today to think about as well. And then pay, like you said, you know, we can't just keep increasing pay. So what can we do? Yes. Then it's around creating that culture that people choose to engage with by understanding the moments that matter. And employee listening is a great way of doing that. We've probably got time for one more question. So do you have any tips for creating the same culture across multiple homes with different regional locations?
Tips? I mean, my first tip would be more of a question, which is it essential that it's the same culture, and therefore is culture the same as your core values? So I'd want our core values to be universal, but actually what I would say to you is I embrace and celebrate the difference of the cultures within the home. So, you know, we have one home that's just, it feels like they must have a party every day. They're on the canal in Islington, and there's always a band playing outside. There's always in the summer a barbecue going, and every time I go there, I'm like, this has got a proper party atmosphere to it, and it feels like it happens regularly. Everybody's up for it and in there. We've got another home that's very reflective. Very serene in the culture within the ambience, the way people speak and talk, which is reflective of the residents. So I would suggest that I wouldn't try to have a universal culture, but I'd look at the core values and say, however that culture manifests, make sure that the principles of the core values that sit behind it are right.
That's really fair. Amanda, thank you so much. We are literally just coming up to the hour. I'm just going to quickly share my screen because in follow-up, we're actually going to be sending through the webinar recording. My lovely colleague Rebecca is going to pull out some of the quotes and some of the things that we've talked about today and share on an infographic afterwards, along with an article around improving the employee experience for the care sector. If anyone would like to book a call with me to talk about employee listening, then my email's there. And if you've got any other questions, then feel free to email me too, as we'd love to talk to you. And look out for an email from Emily and Fiona in the coming week, who will be sharing all of these things with you. But Amanda, thank you. You are a wonder of wisdom and humour and storytelling, and I love every interaction that I have with you. So a massive thank you for joining me today and let me ramble on about buckets and everything in between.
You're very welcome. It's been a pleasure. It's been a pleasure. Thank you.
Brilliant. Thank you, Dawn. Thank you, Amanda. What a great presentation and great webinar for us. Some great insight there, and I'm sure some further questions will come out of this. So as Dawn said there, that she shared an email address, and they'll be in touch over the next coming days anyway. So if you do have any further questions, I'm sure they'll be happy for you to reach out and go through that, anything about WorkBuzz or anything we've talked about today. So that leads me to thank Dawn for hosting. Thank you, Amanda, for being part of today's webinar, and thank you for joining us. And we hope to see you soon on another webinar. Thank you, guys.
Thanks. Bye.
Bye.